There we go. Good morning, everyone. Hi, I am Detroit City Councilman James Tate, representing District 1, and welcome to the first ever live virtual District 1 monthly meeting and as well our first District 1 monthly meeting of 2021. You know, last year was a heartbreaking and difficult year for so many of us, and 2021 has started out pretty rocky as well. There is hope on the horizon, and there's new energy among our community for those to get involved, people to get involved and get things done and make folks in positions like mine work better on behalf of the residents that we serve. With all of the loss that we've experienced lately, I am personally just grateful to be able to serve at this very critical time in our history. But most importantly, I'm just thankful to simply be alive and be able to work on myself internally, focus on my family, my community, and continue to be the best me that I can be, like so many of you watching today. Happy New Year, everyone. Today, again, is our first meeting for District 1 in 2021, and we've got a great lineup. A lot has happened since we last met, and we would like to hit on a number of topics so that we can get this hour and a half, so many of the questions and concerns that you have. You all, like I said, have an opportunity to ask those questions of each guest after their presentation. To participate in the Q&A, if you're watching on Facebook, you can drop your question right there in the comment section. If you're on Zoom, you can raise your hand by pressing *9, and if you're listening by phone. Now, if you're on a Windows computer, you can raise your hand by pressing Alt plus the letter Y. If you're on an Apple computer, raise your hand by pressing Option plus the letter Y. So when we bring you up, please just ask your question, get right to it, D1. We know how we can be. We want to make sure, again, that we get to as many questions as possible this morning. All right, here we go. First up, we have two very important guests joining us this morning, providing insight on the city's effort to combat the coronavirus and the latest on the mass vaccination effort here in the city of Detroit. D1, please join me in welcoming Chief Health Officer for the city of Detroit, Denise Fair, and Dr. Robert Dunn of the Health Department. Good morning, Dr. Fair and Dr. Dunn. How are you this morning?
Good morning. We're doing great. Thanks so much for having us.
Chilly, but
oh yeah, it is a little chilly outside, but you know it's January, so in Michigan, that's a good thing. I'd be scared if it was the other way around. Again, thank you for joining us this morning, and we want to get right down to it. Detroit, we got hit extremely hard by COVID when it was first identified here in Michigan. So many of our friends and families fell ill, and we all have been affected by the sudden deaths that that resulted after that. Detroit became then a model of how government can use relationships and cooperation to fight the virus. And we've seen fluctuation in infection rates around the country. We're now approaching 1 year since COVID was first identified in Detroit. What do our efforts against COVID look like today?
Absolutely. So I'd like to show the presentation. Is that a possibility?
Absolutely.
Okay. So let's go ahead and share that, because I think it's really important for District 1 to see the progress that we've made. It really has been almost a year since the first case on March 11th. So if you can go to the next slide, please. So these are numbers as of yesterday. There are currently 28,097 confirmed cases and 1,766 deaths. So it has been a year, and we still have a long way to go. If you look at our infection rate, Detroit is at 4.9%, and the infection rate essentially is the number of people that are testing positive as compared to those who are testing in general. Detroiters are getting tested every single day of the week. On average, about 3,000 tests are administered, and we're doing much better than the surrounding counties. And that's because Detroiters decided to take this seriously. They decided to wear their masks, and they decided to wash their hands, avoid large crowds, practice social distancing. And that's why we are where we are today. So again, I'm really thankful for all Detroiters who have stepped up And now we can move on to the next slide, please, because now the vaccine is here. If we can go to the next slide. Thank you. So I know many of you have heard of the vaccine. There are two types of vaccine that's available right now to the city of Detroit, both Pfizer and Moderna, and both are highly effective in preventing COVID. And so there are three benefits to getting the COVID vaccine. One, we know that the COVID vaccine will keep you from getting COVID-19. It'll help keep you from getting COVID-19. Really, it's the best tool that we have right now to get back to some sense of normalcy. Two, the COVID-19 vaccination, it's a safe way to build protection. That's really, really important. The COVID-19 can have serious life-threatening complications, and there's no way to know how COVID-19 will affect you. If you get sick, you could spread it to others, to your friends, to your family. And we know, again, that the COVID vaccine is a safe way to build protection. And finally, the vaccine is an important tool to help stop the pandemic. I know we want to get back to, again, some sense of normalcy. But once you get the vaccine, we're still going to be wearing the mask for quite some time. Our governor has set a goal of vaccinating 70% of the entire state of Michigan by the end of 2021. I'm confident that we can get there when we reach our herd immunity, but we still need to practice those safety precautions. I'll pause right there, turn it back over to you, Dr. Tate, Tate, before we move on to the next slide.
There we go. No, I was saying that was too much pressure, Dr. Tate. Ooh. So no, I mean, this is great information. I mean, we know that there is, we've heard all around that there have been some challenges with getting the vaccine to people nationally. We set up a center over at TFC, an operation over there. It's robust. I remember receiving a number of calls. So when people are saying, oh, folks in Detroit are not going to take the virus, well, I'm here to tell you, there is a huge demand. Talk to us a little bit about that demand for those Detroiters who are seeking to obtain the vaccine. Again, talk to us a little bit about the kind of bumps along the way. Again, it's not just Detroit, this is nationally. And then what, if you have a vaccination appointment, should you expect for it to be rescheduled or continue to keep that day blocked off?
Sure. So if we go to the next slide, I guess I can talk a little bit about the TCF Center, but let me kind of speak more broadly. So the vaccine is available right now to all Detroiters, and there are different categories, and I'll get to that in a minute. But I think it's really important to know that the vaccine is in limited supply. We're working really closely with the state to make sure that there is an abundance. We opened the TCF Center about a week and a half ago. And when we opened the phone lines, we had over 150,000 callers. They were calling to get their appointment. So we know that the demand is there. And so at the TCF Center, we've created a robust drive-through where you can just call our call line, and I'll get to that in a minute, but you can call and get your appointment. So there's no cost for the vaccine. Again, we have both Pfizer and Moderna. Right now, any resident in the city of Detroit who's over 68 years old, that means anyone who was born in 1950 or earlier, they can call 313-230-0505, and I'll make sure I repeat that several times throughout this presentation. But once again, 313-230-0505. And if you are 68 years old or older, you can get your appointment and you can come. It's really quick. We ask people to spend no more than about 30 minutes to an hour to get your vaccine. It's a really smooth operation. Now, not only if you're 68 or older, if you are a good neighbor, so maybe you live next to a 68-year-old and you want to drive your neighbor to the TCF Center. And if you're 65, you would also apply. So once again, let's say you're living in one of the neighborhoods and you're 65 years old and your neighbor is 68, you would also qualify to get your vaccine at the TCF Center. If you are a K through 12 teacher or support staff or child care provider, you could also call and get your appointment. We're also opening it up for US Postal Office employees, employees of the City of Detroit or city-related agencies. They're also eligible. And finally, federal, state law enforcement officials who live or work in the City of Detroit, active members of the clergy, they're also eligible, and funeral home and mortuary service employees who live or work in the City of Detroit. Right now, those are the categories that are available to call the TCF Center. Again, 313-230-0505. That's right now, but we're gonna open it up to the City of Detroit within hopefully a few weeks, but it's really based upon the amount of vaccines that we are getting. So we want you to remain patient as we work with the state to make sure there's enough vaccine for everyone who wants to get vaccinated. If you can go to the next slide, please. So I just want to make sure I clarify what this Good Neighbor program is. Again, it's any Detroit resident, a good neighbor who's 65 years old, who can drive a 68-year-old to the TCF Center for their COVID-19 shot. Please bring with you 3 things: your ID, a pen, and a short sleeve shirt. I know it is freezing outside. Today it's about 20 degrees. So please don't come with all your multiple layers of your coats and jackets. But just make sure you have a short sleeve t-shirt on. Again, call us 313-230-0505, Monday through Friday from 9 a.m. to 6 p.m. to schedule an appointment. So I'll pause right there. Dr. Dunn, anything to add at this point?
Yeah, just a couple of things. One, just to emphasize that the programs that the health department has set up to deliver these vaccines, with really the help of every other person who works for the City of Detroit, this is an all hands on deck, is designed to be able to give every dose of vaccine that we can get. And I just want to emphasize what Denise is saying, that we've been working as hard as possible with state and federal officials to get enough vaccine, because we can certainly deliver more. We are set up to deliver more. And any of you that got tested, Councilman Tate mentioned the early efforts that were made here in the City of Detroit. We had the first mass testing site set up for the whole state, and we used a lot of the lessons there. So if you ever went through the testing site and you had an appointment and you got tested and you were able to get through at the state fairgrounds, we used a lot of the lessons learned there for TCF Center. And TCF is just one of the vaccine initiatives that's going on through the health department that definitely you should mention, Denise.
Absolutely. So what we are doing is, we at the health department want to focus on those who are most vulnerable. That's our seniors and those who are experiencing homelessness. So over the last 2 weeks, we have gone to several locations in the City of Detroit. Our goal is to go to 60 senior apartments and 29 homeless shelters by the end of February. So far, we've vaccinated over 600 staff and residents. It's really important for the health department to really practice outreach. That's what public health is. We go directly to our most vulnerable, and so that's part of our plan. Let's go to the next slide briefly, because I do want to make sure people understand what to expect when you come to the TCF Center. Please arrive on time. Please do not arrive early, and definitely do not arrive late. But make sure you have your ID ready. And if you or any members in your car who are getting vaccinated, make sure that you practice safety precautions and wear your mask at all times. Here's just a quick overview of how to get to the TCF Center. Of course, it is downtown, and you would enter right off of the Lodge Freeway and Jefferson Ave. There's plenty of signage entering the facility. Your verification and eligibility will be at check-in. You'll be asked if you have any allergies as a precaution for yourself. Again, please anticipate at least 1 hour for your appointment. As I mentioned, wear a short sleeve. And the TCF Center is open Monday through Friday from 9 until 5. And then if you can go to the next slide again. Yep, next slide. And keep going. Yep. Reiterate, there are 8 categories right now who can call Monday through Friday, 313-230-0505. Again, Detroiters age 68 and older right now. Good neighbors 65 and older who can drive a 68-year-old. K through 12 school teachers and employees, U.S. Postal Office, employees of Detroit or other city-related agencies, and also funeral workers. So those are the categories available right now. And again, we'll be expanding over time. Go to the next slide, please. So I want to just make sure you all know, to Councilman Tate's point earlier, the vaccine is in limited supply. Here's what we've received so far. We've only received about 11,000 doses, but we've administered 82% of those doses. So we're making lots of progress. We've already vaccinated, as I mentioned, 200 or so seniors, 400 homeless, about 2,000 healthcare providers, 1,500 teachers, first responders, et cetera. So we are making lots of progress. And then go to the next slide. So I think this is really important. I want to make sure I say this multiple times, but once you get the vaccine, it's really just a piece of the puzzle. So we have to remember to still practice our social distancing, washing our hands, avoiding large crowds, wearing the face mask. That's all really important, because stopping a pandemic requires us to use all the tools that we have available. So again, once you get vaccinated, still remember to practice those safety precautions. Councilman Tate, we'll turn it back over to you.
Awesome, great information. Thank you so much, Director Fair, Dr. Dunn. I'm just going to ask one really quick question, then we're going to jump right into our Q&A with the folks who are watching today. And there's been some questions about the after effects, if you will, of the vaccine. Again, we want to make sure that we remove any perceived barriers at all for those who are seeking, that we definitely know need to obtain this vaccine, but who may have a question about should I or should I not. Can you talk to us a little bit about the side effects? And honestly, and I know that there's always, no matter what we're talking about, some type of side effects, large or small. But from what I'm understanding, the reported side effects have been very minimal compared to the number of individuals that have actually been vaccinated. So talk to us a little bit about that, please. Very briefly, so we can get into the Q&A with our D1 residents.
Sure. So, and not only do we have the information from the studies, now that we've done all these vaccines here in Detroit and our health systems have been vaccinating their personnel, we actually have some local data on this, which looks very similar. So there's 2 doses of this vaccine, just like some other vaccines, like the hepatitis A vaccine that many of us got as children and some of us got as adults. You get 1 and then you get a second dose. The first dose, the most common side effect is really just a little local discomfort, very similar to getting a flu shot. A few people will have a little muscle aches and things like that over the next 12 to 24 hours. Of course, there are things that in any vaccine, usually it has to do with preservatives and other things that kind of keep that vaccine as a liquid that some people can be allergic to. So we ask those questions of everybody that comes in. Once people get the second dose, people tend to have a little bit more of a reaction. It's just like your baby. You get your first set of shots, your DPTs, and then the second set, your child gets a little bit of a low-grade temperature over the next 24 hours. And it's similar with the second shot. We see a little bit more of that in the second shot, and we've definitely surveyed our first responders and people who've had their second shot now. I had my second shot, and I felt a little achy the next day. I did not have a fever, but some people have a low-grade temperature, easily treated with Tylenol. And that is the most common side effect. Again, a little more common after the second dose. Pretty much everyone's going to have a little bit of arm soreness. Denise, you've had your vaccines. You can comment on that too.
Yeah, no, I had my vaccine, my second one, I think 2 weeks ago now. And I did have just a little bit of slight discomfort. I was also tired the very next day, but I feel completely safe now. So I feel really good about where we are, and I encourage everyone to highly consider getting the COVID vaccine.
Yeah, and just listening to you and the side effects that we're talking about, they don't compare at all to actually having COVID. And we know
Absolutely.
that is the case. So if you want to weigh the costs and benefits, if you will, of getting the vaccine and not getting the vaccine, here you are talking to individuals who absolutely have had theirs and firsthand knowledge. All right, so now we're going to get to some of our folks who are watching today. And I know we do have some questions on Facebook, but again, for those who may have some challenges in how to participate, if you're on telephone, press *9, raise your hand. If you're on the web, if you have a Windows computer, it's Alt plus the letter Y. If you're on an Apple's computer, it's Option plus the letter Y. But again, if you are on Facebook, just type in your question and we'll get that question answered. So Aisha, what's our first question? Who do we have?
Good morning. The first question we have from Facebook is from Eric Hobson, and he said, have the panelists received the vaccine and which one?
Sure. So actually, we both received the Pfizer vaccine. The Pfizer vaccine, it's 2 doses, similar to Moderna. And we took it on day 1 and then took it again, the second dose on day 21. So yes, we both took the Pfizer vaccine.
So I'm hearing about, I think it's a Johnson & Johnson vaccine that is also looking very promising, but it's a 1-dose shot and it's not as volatile, if you will, in terms of the way it has to be handled and treated like the other 2. Any information on if that is going to be crossing over the threshold and being included into the cadre of weaponry against this COVID battle?
Sure. So that vaccine, they should have, for people who were kind of looking at what happened about how these vaccines were authorized for use, they had to get to a certain point where they had studied enough people. There were over 30,000 people in each of the trials, and they had to watch them for long enough to make sure they still had immunity, right? That's the real test, right? Are they still immune? And they do that by doing blood tests on people. So the Johnson & Johnson trial started a little bit later than the clinical trials of the other 2 vaccines. So they are just getting to that point. They've got their data, they're analyzing it. It should be going to the FDA shortly, as what's happened during COVID. There's an independent panel that's non-governmental and not people from industry who are reviewing that data and then making a recommendation for the FDA to look at it. So they are almost ready to do that in terms of the numbers of people that they've had vaccinated and long enough. And there are a bunch of other vaccines kind of coming down the pipeline. I think in the world as a whole, they started with 140 candidates across the world. And there are at least 8 in late stages of clinical trials in the US. And most of the rest of them are single-dose vaccines.
Well, I'm sure a lot of folks like me who don't like needles at all love to hear about the one dose as opposed to the 2 dose. But in the meantime, we got to do whatever we have to stay safe, everyone. I think we got a caller or someone who has a question on Zoom. Yelena, good morning. Who do we have on Zoom?
Good morning. I am moving over Miss Ashley Miller. Promote to pen.
Miss Ashley Miller, good morning. Thank you for joining us. Do you have what's your question for Denise Fair and Robert Dunn? Oh, she's still on mute. I see the mute.
Okay.
See, that's why I can't wait until we get all these vaccines and the herd immunity. So we don't have these meetings
Oh,
anymore.
it's just anyhow.
Yes.
Technical difficulties. Hey, how are you?
Good morning to everyone. Yes, Ashley Miller's name is appearing on my Zoom meeting because she is down here from Ferris State using my computers and changing all my gadgets.
That's what they do. That's what they do.
Fantastic. Councilmember Tate, thank you so very much for your support of us in D1 and for your support of the citizenry throughout the city of Detroit. Oh, you are doing real well, and I am so proud of you and have always been proud of you ever since I met you through your mom.
Thank you.
Okay, what I wanted to say really was, in my example, I know of maybe 5 older adults who have received the COVID-19 first vaccination, and I'm one of those people. I know of 2 people who else, I won't share their name, in our neighborhood who are looking forward to having the vaccination administered. we are excited. We are real excited about being in the community whereby the access for us, all it took was a call through a recording system that worked for us really in real time. So, and I understand some seniors, especially folks in the African American community, who are reserved about the vaccine. But let our history be our history, and let's get on board and take advantage of the city of Detroit being able to have us access this vaccine, because I know outside the city of Detroit, a lot of communities are not as fortunate to have a real-time appointment as we are here in the city of Detroit. So thank you, Councilmember Tate. Thank you, Mayor Duggan. And thank you for the city of Detroit. And
Thank
on
you.
that, I'll go out.
We appreciate you, Commissioner. Thank you so much for
Sure.
everything you do as well. I think we have some additional questions on Facebook. Aisha, who do we have? What's a question on Facebook?
We have a question from Josh Engel. He said, do you all support mandatory vaccinations?
Okay, so that's a really good question. In the city of Detroit, Mayor Duggan has not pushed for mandating vaccinations at this time. I think just because there's so much that we're learning about the vaccine. I'm also very supportive of his decision. I think over time, perhaps there will be another conversation regarding the mandating, but at this time, that is not a plan for the city of Detroit to mandate vaccinations at this time.
Got it. Thank you. Next question on Facebook, Aisha.
We have another question from Eric H. Hobson. He said, usually someone younger will drive an older person, or an example, a son, daughter, nephew, or niece would drive that older person. Shouldn't that driver, no matter what the age, be labeled a good neighbor and be offered the vaccine?
Thank you for the question. At this time, it really is only available for good neighbors that are over 65. However, I imagine in the next couple of weeks, that good neighbor option may be expanded to include younger people, but at this time, it's just available for those who are 65 and older to be good neighbors.
And I can just say that we have been working as hard as possible to get more vaccine. That is absolutely the key. And we want to expand that eligibility. We've been at the forefront of pushing expanded eligibility in the state of Michigan, and we want enough vaccines to get everybody who wants a vaccine.
Absolutely, and I think that's a good point. The TCF Center has been designed to vaccinate about 20,000 people a week. And we want to do it, but we don't have enough vaccine at this point. And so again, we have, as Dr. Dunn said, we've been working really closely with the state to say, we have the demand, just give us the vaccine and we'll start to administer as many vaccines to those who would like to be vaccinated.
All right, so we're getting a little closer to the end of this particular segment, but we got time for at least one more question. Yelena, who do we have for the next question on Zoom?
Okay, I just moved over Tommy, and he is unmuted and ready to ask his question.
Good morning, Tommy. Good to see you. How are you today?
Good morning. Good to see you, Councilman Tate.
Yes, sir.
Denise and Robert, I had a question regarding infection rates. Are we able to, as Detroiters, are we able to view that real time? Is there a tracker online that we can view the infection rates per zip code?
Yeah, it's a good question. So if you go online to detroitmi.gov/health, there is a box that says COVID-19 dashboard. And you're able to see in real time the infection rate, you're able to see the zip codes, you're able to see the demographic breakdown. It's a pretty impressive dashboard. So again, it's detroitmi.gov/health, and then click on COVID-19 dashboard.
All right. Yelena, I think I've got a gentleman who had his hand up the entire time. Let's switch him over right now before we segue into the next segment, please.
Yes, it's Mr. Keith Williams, who should be over. Okay, I don't know where he went. I moved him over. I don't know if he.
There, I see the name pop up.
Okay, so there he is now.
Ms. Williams, you're on mute.
Yeah, there he is, Mr. Keith
Oh,
Williams.
you kicked me out for half a second there. That's okay.
Good morning to you. Thanks for joining us, Mr. Williams.
Thank you all for all of the hard work that you're doing. Having spent an entire career in healthcare, I do understand the hard work and the sometimes lack of recognition. But anyway, my question is a real simple one. It's about the Good Neighbor program. If there are two people in the vehicle that meet the age criteria, bringing the third member who is 92, how do you handle something like that? Is that possible? I understand you're one for one, but you got two people in the vehicle that are of the age requirement.
Yeah, so I think that's a really good question. I would definitely encourage, if you have maybe two people, that's fine. As long as, again, they have to call that number, the 313-230-0505, then they can get vaccinated. I would just tell the call center rep that you have, two people who would be good neighbors. That should be no problem.
Yeah, and I've been down there every day, and we have had folks like that, and I think that's absolutely great, and it's ends up being a pretty good way to vaccinate people. But just like Denise says, just make sure they know that at the call center, because that's how we know when we're kind of out of appointments based on the amount of vaccine. Literally, it's every day we are looking at the number of vaccines we have for the next day. So.
All right. Well, I mean, you all are the very first guests that we've had on our first virtual live D1 monthly meeting. I want to thank you for joining us today and honoring us with being able to provide information to the community, very important information to the community. I wish you all the best in what you are doing to keep us safe and informed. And as a council member, if there's anything else that I can do to assist you, let me know, but you are always welcome here to give your message to the community. So again, thank you both. And please be safe and be well as you continue upon your day. Thank you so much.
Thank you, Councilman Tate. The last time I think I was there, we were doing CPR training.
CPR, that's right.
So we're looking forward to getting back to more health promotion. We always appreciate your support.
Thank you. Thank you again. Well, take care. All right. Well, next up, the city has begun a very innovative and first of its kind program that identifies families with the greatest need in our city and connects them to the vital services such as food security, utility payment assistance, home assistance programs, water assistance, and much, much more. The only way to end the generational cycle of poverty that we see in our city and so many families is to provide the necessary services that address the root cause of each individual's specific situation. There's no one size fits all approach. And those one size fits all approaches, we've found that they typically don't have lasting change. And joining us today to talk about how the Detroit's Community Health Corps is helping to improve the quality of life for the most vulnerable residents in the city of Detroit is our Deputy Mayor of the city of Detroit, Conrad Mallett. Deputy Mayor,
good morning.
Thank you for joining us. I appreciate you.
Not a problem, Mr. Chairman. It's always a pleasure to be in your company. These moments when we're in touch with the community, particularly under these circumstances,
Absolutely.
I really appreciate your energy around this process.
Yes, sir. Yes, sir. When I saw this, I was excited. When I saw, all that the CHC had, the potential it had to do to change so many lives. If you would talk to us a bit, if you will, about how the CHC came about and what are the short and long-term goals of the program.
So, Mr. Chairman, when I came back to the city for my third term of service in June of 19, Mayor Duggan came to me and said, Conrad, I need for you to design a program with Denise Fair, with Nicole Sherrard Freeman, with David Bowser, people who are expert in this area, so that we can find a way, based on the model, Mr. Chairman, that had made itself evident when the Detroit Water Department did an outreach campaign to make people aware of the availability of funding to allow them to pay their water bills. Gary Brown had initiated, with your help and with the help of the state of Michigan, a very comprehensive program to help people pay their bills and lots of people weren't taking advantage of it. So literally, Gary and Metro West, one of the larger social service providers in the city, went out, Mr. Chairman, based on data from the water department, just started knocking on doors and saying to people, you are eligible. That experience then informed the CHC effort, because when Gary and his team got there, I mean, they saw, Mr. Chairman, that sometimes not having water was the least of the problem. Sometimes there was mold on the wall, broken pipes in the basement, and no heat in the home. And so what you were looking at was a whole series of issues, and the water department's ability to handle the water-related issues really left a huge gap for these families. And we determined that we wanted to fill that gap. And we also wanted to do something more, Mr. Chairman. All of us are very appreciative of the 211 program run by United Way, where you can call in, dial 211, and they will direct you to social service agencies that are designed to deal with the problem that you identify. But again, what was missing was a holistic approach to managing all of the problems, number one. And number two, some of these entry points are quite complicated. Sometimes, for instance, the Department of Social Services application at one point was 32 pages long. It's only 10 now.
Wow.
But at one point, it was just overwhelming. And people in immediate need just did not have the wherewithal to get the help that they needed without support and guidance. So we wanted to design a program where, number one, we would find people in emergent circumstances, that is, circumstances, Mr. Chairman, where they needed help right now, get them the immediate assistance that they had identified for us they needed. And then once they had caught their breath, kind of manage their family into a modest amount of safety and stability, to begin talking with that family about next steps. Where are we going to go? And what are the dreams that you have for yourself that you want to realize, that we, over the course of time, can help you along a path that will get you where you want to be. It's not immediate, Mr. Chairman. These results along the lines that I just described don't occur overnight. Right. In a city where the poverty rate hovers around 35 to 40%, people living below the poverty line, the need, as you know, is tremendous. But we believe that the way we are currently constructed, the Detroit City Council gave us, through the COVID dollars that were available, the opportunity to stand up the Community Health Corps. We have a director, Sheila Clegg, a deputy director, David Bowser. We have a lead case manager, 4 case managers, and 20 community health workers. These are persons, Mr. Chairman, who literally go out into the community and knock on the doors, and we will be doing that much more strenuously once we can get past this COVID circumstance that we're operating in now. The goal, though, is as we are in touch with these persons, dealing with their emergent issues, to then really, and what we've described is creating a passport plan that the client and the social worker then will work together on. And what we want to be able to do is to demonstrate to the Detroit City Council and to the funders and to the governmental entities that we hope will support our efforts more vigorously, that we are making progress. So we just started. We began literally toward the end of November. And we're very proud of the effort to date. Our team is all hired. There are 202 people in the actual CHC program. There's 574 people, Mr. Chairman, on the waiting list.
Wow.
And I just want to talk about that for a second, and then I'll step back and allow we can go through the slides. Those persons, Mr. Chairman, on the waiting list have all been contacted or are in the process of being contacted. No one is on that waiting list not having heard from us or not in the very, very near future. And I'm saying the next 7 days, not having heard from us so that we can help them deal with their emergent issue and then direct them like 211 to a social service agency who can give them help that we are not able to provide because of the capacity issues that we have. So that's the introduction, Mr. Chairman, and my colleague David Bowser is here, and we've got slides as people in situations like this always do.
You've done great. I mean, what you've given us is essentially a lot of the information on the slides, and that shows that you have a great breadth of knowledge on this particular subject. Again, thank you for being here. So we want to make sure we have enough time for Q&A for
Right.
the folks who are calling in. And we absolutely have a few of them. Do you need to use the slides? If you don't, we can just
You know what, Mr. Chairman? Yeah, really. God bless you. If I can not use the slides, I'd be very happy.
There you go. I love it. I love it. Like I said, you've given us a lot of information. We're going to make sure that the slides are available for the community to review following this broadcast. Now, I will say I did see one question. Someone asked, what does CHS stand for? It's actually CHC, if you see that.
Right.
It's Community Health Core. Community Health Core. Now, Deputy Mayor, I'll start off with the question, just the first question. Tell me about how this concept, I know we kind of looked at, what Gary Brown did in the water department, but is there any cherry picking that we did from around the country and looked at how we can make what they're doing better, work better for us in the city of Detroit and narrowly tailor it to our individual situation?
Absolutely, Mr. Chairman. So there are two programs similar to ours. One in Boston, which is focused on young women who are pregnant. And then there's a more comprehensive program in Baltimore. But what they don't have is what we have, and that is the job connectivity. In Baltimore, it's the CHC program designed to manage a family through the social service labyrinth, but not designed to connect them to a job. The strategic difference between us and them is we are located in the Detroit at Works program. So we are a sub-program under DESC. And I know that was initially very concerning to our social service community partners. But I think that they have seen that, with persons like Sheila Clay, persons like David Bowser, the social service integrity in terms of program delivery is well intact. And what we don't do, Mr. Chairman, is say, okay, Mr. Smith, you are now, your emergent issue is dealt with, you're directly into a jobs program. We recognize that it is not a one-to-one. This is a process. This is a pathway. This is a continuum. And so now we hope that eventually we can get Mr. Smith to the point where he can identify a job or education opportunity that we can help him with. But that's not the reason that we exist, Mr. Chairman. We exist to create a foundation so that Mr. Smith and his family can plot their own pathway forward with our help and assistance.
Awesome. We do have questions coming in from Zoom. Yelena, I know we got certainly one call, one question thus far, or maybe even two. Who do we have, Yelena?
Okay, so we do have Cher Connor, who I've moved her over, and I just letting Mr. David Bowser.
All right.
David Bowser is my colleague and the deputy director. And if there's any in-depth issues that come up, David is here to back me up.
Awesome, awesome. Sherry Connor, good to see you. Thank you for joining us. Happy New Year to you. You got a
Happy New
question?
Year, Councilman. Good to see you as well. I'm glad I came on, and this actually is something that I'm dealing with. During the peak of the pandemic, I had a pipe break. I did have homeowners insurance. They refused to cover the damage because there was a lot of extensive mold damage because of the lockdown, and I was not able to get anyone to come in for those months that we were kind of on a restriction. I did reach out to 211, Wayne Metro, and several agencies, which I wound up running into a brick wall. Wayne Metro initially told me their program was set up for, the water issue, but I did not have my water shut off. So they said I didn't qualify. But if I would have my water shut off, I said, this is the most backwards thing I've heard in the middle of a pandemic. So anyway, they got more funding through the CARE program, I believe. And they did give me an email during the summer, and they set up me an appointment. I want to say in July, they sent out some plumbers. When the plumbers saw the mold, they were like, I guess they went back to Wayne Metro and they were like, we can't, we don't have the, we can't go into her home with the mold level. So what happened for me was eventually my insurance company dropped me. When I got dropped, my insurance, when I was fishing around for insurance, the rates have tripled. So here I am still now. I have 2 children in my home. I have the mold has spread throughout my home. I've tried to call United Housing, so many programs. They have everything but assistance for mold. So I am like in a pickle. The only thing my insurance company did allow for was a mold remediation company to come out and evaluate. And thank God it's not black mold, but it's some other type of mold that they told me I literally have to get rid of everything in my home. So I've been in a pickle, and I'm wondering that program that you mentioned, I've heard of it before, but I scoured online. I couldn't find out direct information about what it would assist, or if I would even fall into a category for someone that would qualify for that program.
Yep. So, Sherry, they're going to give you that information. Deputy Mayor, Mr. Bowser.
Right. So, Ms. Connor, I'm going to assure you that David Bowser, my colleague, is going to be in touch. David, give her the number that she can use to be in touch with you.
Yeah, definitely. You can reach out to me directly at 313.
Hold on one second. Can you, Lena, post the number, or is there a slide that you have the information?
Yep. So we actually have a resource guide that we, and you've attended our meetings in the past, we prepare a resource guide of all of the presenters and how to get in touch with them. And we're going to make sure that you have that resource guide as well. I'm sure Mr. Bowser's information and those other members of the CHC, the Community Health Corps, is on that particular resource guide. So we'll make sure you have that.
And Ms. Connor, can you do me a favor and make sure that Chairman Tate's office has your number, and that way we can call you, and because we want to make sure we close this loop.
Yeah.
Thank you so much. Mr. Browse, I can take your number right now. I just wasn't prepared at the time. 313.
Well, if you could provide.
Why don't we take your number, Ms. Connor?
Okay. The number that we're going to give out is the best number. Sherry, we'll make sure you contact it or have a contact, and that's for everyone. We'll make sure you have that contact information if you have any follow-up questions. Thanks for joining us again, Sherry. Appreciate you. Wish you all the best, my sister. All right. I know we do have a question from Facebook. Aisha, what's our question from Facebook?
Hobson asked, how do you sign up for the CHC program? Is there a website?
David?
Yep. So we have the phone number and we have an email address where we can take your request. So essentially what you would do is you would be added to a wait list, and then we would have the staff reach out to you to address your need. So that information is going to be provided at the end of this presentation as well.
Yeah, Mr. Chairman, if I might, the problem is capacity. With the limited funding that we were able to secure, and again, I want to thank you very much for your support.
Absolutely.
We've only got the one group. One of the questions that City Council had, if you remember, was capacity. And there was a great concern that the case managers would be overwhelmed and not be able to do the work that we wanted them to do. Right now, they're all operating at about 50 cases apiece, which is above the recommended benchmark, but the need is so great that we've got them maxed out. That's why David is talking about this waiting list, which I referenced earlier.
Got it. All right, I think, do we have any other questions from Zoom or Facebook team?
No more questions on Zoom, Councilman.
And on Facebook.
All right. Well, see, that's what happens. I told you didn't need a PowerPoint, Deputy Mayor. You gave them all the good information, and they were looking to retrieve that information. Anything else you want to add before we wrap up the segment?
Yes, sir. I just want to assure you, Mr. Chairman, and the community at large that we have great faith in this program. We have applied. The governor, as you know, offered up, I think it was a $450 million supplemental. We've applied for $1 million grant on behalf of CHC. If we get it, it'll come back to City Council for authorization. We've also, we're asking for $6 million under President Biden's $1 trillion program. The city of Detroit obviously is going to have a multi-million-dollar ask, but our faith in the program is such that we really believe that we get 4 or 5 more case management teams. Clearly, you can see the need clearly in 90 days. And one of the things I just want to say to the community, we are committed to and will be coming back to the Detroit City Council and sharing our data with our legislative leadership, just to be sure that they know what we're doing and the progress that we are making. So this is going to be a very transparent effort, and we appreciate, Mr. Chairman, your support.
All right, Mr. Mayor, one last question, and we're D1. Is there anything in specifically in District 1 that stands out at all in terms of the need? I know at one point in time we had some of the highest rates of water shutoffs. At one point in time in District 1, we had the highest rate of, at least one of the highest rates of COVID infections. Any anecdotal information right now as it relates to how we're collecting data, how the CHC is directly affecting District 1, or anything you want to add to that premise?
So, yeah, David manages the data. David, do you remember the statistics for D1? Because we have all the participants, Mr. Chairman, broken out by district.
Absolutely. So if you all view the slideshow, there is a map that shows clusters based on district of program participants. And so District 1 has a pretty dense cluster of active clients and clients who have received services. We've also met with District 1 to determine exactly what specific resources are available.
Mr. Browser, hold on one second. Reggie, can you pull up that slide while Mr. Browser talks so we can get a visual? I know you had that resource guide, and I appreciate that, but let's get that slide up so we can get a visual as he speaks. But you can continue, Mr. Browser.
Yeah, based on the needs of each district, we're also putting together resource lists that are available per district so that we can kind of expedite resources for individuals that reach out from those districts too. And so we're meeting with each district now to determine, stakeholders in the area as well as resources that are available. So if you can see here, District 1.
Blow that up a little bit, Reggie, so we can see it.
Go back, there it is.
There it is.
Yep. So we have active cases, 28 active cases in District 1, 35 cases that we are reaching out to right now. And then we have about 9 individuals on the wait list in District 1. And so, that's one of the more dense areas when it comes to need and when it comes to active residents that we have in our program right now.
Got it. All right, we appreciate it. Gentlemen, thank you so much for joining us. Thank you, as I often say to folks who come on board, thank you for your leadership, because I get a bird's eye view of it, where some folks don't necessarily get a chance to see. They see kind of like the news clips or the the articles, but I get a chance to see the hard work, the sausage being made behind the scenes that you all are doing. So again, thank you for all of the work that you do in keeping everyone safe and doing an earnest job in trying to turn lives around for Detroiters, because if their lives turn around, all of our lives are improved.
No question.
So again, thank you for joining us. As always, you can always come back again. The door is wide open for you. You got the final word, Mr. Deputy Mayor.
So, Mr. Chairman, again, thank you very much. We do believe that this is an important program. I personally, and I know David shares this belief, we feel a great deal of responsibility to get this right, because if we do, it becomes a national model as to how this work needs to be done. So we're very excited and we appreciate your support, absolutely.
Well, thank you, and we wish you the best. We wish you well, and stay safe as we
Take
still
care.
there in the COVID situation. All right.
Thank you.
Talk with you soon. All right, D1. We're now going to be talking about a new, very innovative program that we have in the city of Detroit called Project Clean Slate. Now, just a statistic, the state of Michigan currently has an incarceration rate of 641 per 1,000 people. That's not a small number at all. With the renewed focus on criminal justice reform across the nation, there is a significant movement taking place right here in Detroit. New laws making it easier to get records expunged will take effect this spring and will double the numbers of Detroiters eligible for the program. Joining us this morning to discuss Project Clean Slate is Ms. Carrie Jones, who leads Project Clean Slate for the city of Detroit, and Ms. Bernita Robinson, who is a client who knows firsthand how beneficial this program is. Ladies, we want to thank you for joining us this morning. We'll start off first with you, Ms. Jones. Congratulations on the success thus far of Project Clean Slate. For those not familiar with the program, if you can please provide us with details on what Clean Slate is, who's eligible to participate, and then also tell us about the new change in the law this spring that will make it a little bit easier for Detroiters to gain access to better jobs, housing, and educational opportunities.
Oh, absolutely. And thank you so much for the opportunity to come and join you this morning. I'm so appreciative of it. And, just so happy to be able to talk about our program. And thank you so much, Benita, for joining us as well. I think that you all are going to really enjoy hearing her story and learn in her experience with Project Clean Slate. So if we can see the first slide. So Project Clean Slate is a program that was started in the city of Detroit in 2016 as a way to help people get their records expunged and find better employment and things like that. There's approximately 215,000 Detroiters that have a criminal record. And for a lot of those folks, finding better employment, finding housing, volunteering, all those kinds of things can be kind of a challenge. And so the city said, what can we do to be helpful and help people remove their records? So they started this program. It's totally free to Detroiters. And basically the city of Detroit acts as your attorney. We take your case and we help file all your paperwork, walk you through every step of the way, and take you to hearing so that you can get your record expunged. Can I have the next slide, please? And so this is our team of people. We are small but mighty. We've got 2 full-time attorneys and a part-time attorney and a project manager. And these are the folks that work with Detroiters every day to help them get their records expunged. And a lot of times folks ask us, really, what is the process? Because it can be kind of intimidating. A lot of times people don't seek expungement because it's costly. If it can cost up to $2,000 or $3,000. The program it can be kind of confusing. We had a client recently tell us that she did all of the paperwork, all of the legal work for her divorce, but she couldn't figure out how to get her record expunged. And can I have the next slide, please? So what the process is, first you just come to us and tell us about that you'd like to seek expungement. So it's a really easy process. You can sign up online directly at our website, which is www.detroitmi.gov/Project Clean Slate. And there we have you just fill out a form. And it's easy to do. The information that we request is your name, your address, your date of birth, gender, race, things that are all, it takes like less than 5 minutes to do. And then we have you upload your ID, and then we get to work. So we will then review your records, we'll pull your iChat, and do all the things on the back end to make sure that you're eligible for expungement. And if you are eligible for expungement, then we set up your hearing. We have you come in and get fingerprints taken and sign the application, and then you're ready to go. You're ready for your hearing. So then we'll assign an attorney to represent you. And the benefits are really great. So we find that there's about a wage increase of 23% for people who have their records expunged 1 year post expungement. So we've seen that both it bears out in statistics, but also anecdotally. We had one client who came in, he got his record expunged. He was able to apply for a new position, and he went from making $10 an hour to $26 an hour. So it really has the potential to really move the needle in people's lives and, and provide for all kinds of different opportunities. So, and you know what, I sort of like the deputy mayor in that I really am bad at slides. I just love to talk about our program, and I can do forever, but I have a hard time with the slides, but I think it's important to have them because, we want to make sure that we're really walking people through. So I think I'm a few slides ahead, but it will really, the slides just kind of walk you through exactly what happens in every step of the process. So, one of the things that we saw during, when we started this program is that about 10% of the people that came to us, only 10% of the people were eligible. So we had 6,000 Detroiters apply for our program, and we only had about 10% of those that were eligible. That was because the legislation that we currently have is sort of restrictive. So it allows you to expunge up to 2 misdemeanors and up to 1 felony. No driving convictions were eligible, no marijuana, and that really eliminated a lot of people. So there's approximately, under the current legislation, approximately 82,000 Detroiters that are eligible, but again, the Detroiters that we were seeing were not. So we said, we need to do something. And there was a lot of excitement and enthusiasm about criminal justice reform. So we joined with a number of bipartisan legislators from all over the state to really help craft legislation that would impact a greater number of people. So the new legislation that takes effect on April 11th more than doubles the number of Detroiters that are eligible. So whereas now there's 82,000 Detroiters that are eligible, in April we will have 168,000 Detroiters that are eligible. And the law expands substantially. So now you can have up to 3 felonies and an unlimited number of misdemeanors. So that, and driving is now included. So if it's driving with a suspended license or something like that, those misdemeanors are now included, whereas they were not before. It now includes marijuana. And so we, I think we just have this we're at a tremendous moment in time where we can really impact a lot of people's lives. So about 90% of the people that come to us say they are doing so because they're looking for better employment. But on the other side, after people have their records expunged and we've surveyed them, they say that there's about 82% say the number one benefit is having that stigma removed. So I think those two things put together are really powerful in telling the story of the impact of expungement. It's a great program, and it's, thank you so much for your support, Councilmember Tate, because I think it is truly, a great service and a way to move the impact in people, or change the, change people's lives. So I'm rambling again. Once I get
No, you're
started
not
on
rambling
Project
at
Clean Slate,
all.
I just keep going.
No, but it shows that you are vested in this program. Again, it'd be one thing if you put everyone to sleep based on you not having information, but here we are having all this great information. I see on the screen we have right now the application, how to apply to Project Clean Slate.
Yep.
And we talked about earlier how difficult some of the documents were. Right here, I'm looking at it. Pretty simple stuff we're talking about.
Yep, and that's all you need to do. I mean, you just fill it out online, and Benita's here, and I think that she can really talk about her experience with the program and what it was like working with our attorneys. And I know that it can be kind of intimidating. I mean, I know in my life, like whenever I have to work with a government agency on anything, even sometimes paying parking tickets or taxes or whatever, it can be very intimidating just to kind of get my foot in the front door sometimes. And so I think it'll be great to hear from Benita on what that process was like working with our team.
Yeah, Ms. Robinson, good morning. Thank you for joining us. We appreciate you.
Hi, thank you for having me. I appreciate it.
Absolutely. Now, you as being as a client who's gone through Project Clean Slate, talk to the audience. People may be a little skeptical because people are skeptical about Detroit City programs. They don't do stuff right. They think that we skip steps. But you experienced Project Clean Slate and the team there. What was your experience like?
Well, first of all, thank you all for having me here to talk about my experience. I did have a really great experience, which is the reason I'm here, and want to definitely share with folks to hopefully ease some of the worries around that. So I started the process, I think it was like mid to late summer, where I signed up, and applied to get help from the program. The program was a lot smoother than I thought it would be. I really thought that I would have to kind of jump through a lot of hoops, but the attorneys there actually took care of everything. The only thing that, I really had to do was go get fingerprinted. They filed all the paperwork. They notified me of hearings and all of that stuff. So, I really I'll share a little bit about my history and what they did for me. So I actually had, Carrie and I talked mostly about one. I actually had 2 misdemeanors expunged. They both were from over 15 years ago. And so for me, it was more so the stigma piece that I really wanted to remove from my record. I've done a lot of things since then and really wanted to just have sort of a clean slate, so to speak. And so one of my misdemeanors was for possession of marijuana. The other one was for retail fraud. And the one that Carrie and I spoke about was the retail fraud because, one of the things I shared with the judge, which is kind of sad, a sad situation to be in, was that back then I actually had stolen some clothes for a job interview because I couldn't afford to buy anything. And so, so I have my own opinions about the criminalization of poverty and that sort of thing. But this, so I'm not at all, I guess, ashamed of those things because I do talk about it a lot with folks that I encounter now in the professional world. But we know how the world works and it does interfere with a lot of opportunities for individuals such as employment. I am blessed to say that, I have had gainful employment since this. I currently work at Wayne County, Avalon Healing Center. We just changed our name, formerly Wayne County Safe, which is a program that services sexual assault survivors. But I also see that I work with the population. Most of my survivors come from Detroit that are in need of this type of thing as well, because they also have records that interfere with them moving up and being successful. So again, the process is really smooth. They really eased my fears around just having to face a judge, having to file paperwork, all of that stuff. And I just can't speak enough about the program, and I would encourage folks to give it a try for sure.
See, and that's what we like to hear, someone who's actually gone through the program, because you can, listen to folks like me as a government official, you need to do this, and we are doing all this great work, but to hear it actually from someone who's gone through the program and had connectivity with the attorneys and folks from Clean Slate. Again, thank you for that perspective, because you give one that I could not. And
Thank you.
definitely needed here. Now, Ms. Robinson mentioned, and Ms. Jones, you also mentioned about marijuana convictions, which is huge for me. You know, I'm the sponsor
Right.
of the adult use marijuana ordinance. And, you know, here we are talking about, and I've said this a number of times, we're talking about a drug that, you know, many people are, you know, many of our brothers, sisters, cousins, uncles, you know, family members are going to jail for years. A little dime bag, right? But now we have people who are making big money, a real good livelihood, and potentially able to generationally pass it down on that same plant, that same substance, so to speak. So it was just unfair. How do you think that the change in this law is going to affect those who have previous marijuana-related convictions?
Right. Well, so there's a special, and I'm going to put an asterisk here that I'm not an attorney, and we have great attorneys on staff. So, and they'll be happy to kind of even talk through more details as people have questions. But there's a carve out in the legislation, or not carve out, but there's a special section that addresses the marijuana specifically. So it says, basically, people can have any conviction expunged that would now be considered legal under the new marijuana laws. And that process for marijuana convictions specifically is a little bit different in that you don't have to necessarily do all of the same steps as a typical expungement. It's just that if you have to fill out some paperwork, and if the prosecutor doesn't protest, then those convictions are wiped off your record. You don't have to go to hearing and all of that kind of stuff. So we think that's going to really impact a huge number of people. But a lot of times it's, you know, it's sort of the things that roll together that kind of cause, you know, that can cause problems. So it's like if you get pulled over for a broken taillight, and then you've got, you know, maybe there's like marijuana in the car, or, you know, a concealed weapon or something like that. And then those things all kind of start to pile up and snowball. And the new legislation addresses that too. So anything that comes from like one bad, you know, they call it one bad night, you know, those things will be treated just as one conviction. So, I mean, I think there's just a lot of opportunity and ways that, you know, people who have been, you know, wrongfully, you know, penalized for these things for so long, now have a chance to, you know, get their records clean. And I just was, you know, we had a client come in last week, and he had 9 misdemeanors, and they were all for, you know, driving with a suspended license. Like, they were for different things. So driving for a suspended license, driving without insurance, but they just kept snowballing and adding up. And so this, you know, he said he had spent a good portion of his career working as a delivery driver and was really good at it. He told me he's very fast. He knows the streets of Detroit really well. And he's really excited about being able to get those things cleared off his record so that he can go back to doing something that he really loves. So, you know, but I think that the marijuana piece, I think, is just going to really be huge. It's going to be a big deal. You know, and there's also in the legislation, and it takes effect in 2 years, there's now automatic expungement. So people who have up to 2 felonies and a certain number of misdemeanors after, when the new automatic expungement legislation takes effect in 2023, things will be automatically cleared from their records. But that's still a little ways off, and there's a lot of different waiting periods and things like that. So we're just encouraging everybody to sign up with our program now and let us help you now. And, you know, we can navigate through the process with you.
Yeah, it's certainly going to be a lot easier 2 years from now, you know, because it happens automatically. But, you know, until then, we have a resource right here, a free resource for Detroiters to utilize in Project Clean Slate. I want to make sure we have enough time, because we're getting close to the end of the segment.
Yep.
I want to make sure we have enough time for any questions that we have. And I believe we do have one on Facebook. Aisha, who do we have on Facebook? What's our question?
Yes, we have one question on Facebook from Eric Hobson, who has been very active this morning. His question is the expungement for convictions in Detroit or statewide?
Good question.
Yeah, that's a great question. So anywhere in the state of Michigan. So our attorneys have done hearings in Sault Ste. Marie, Ionia, Alma, Grand Rapids. And so as long as the conviction takes place in the state of Michigan, we can help you get it cleared off your record.
Awesome. We see another question, I think, in the chat here. Someone asked about the DUIs are for alcohol. How do they play into the potential expungement? Any changes that may have occurred?
Right. Yeah, so currently they are not eligible. There was legislation that passed, but was vetoed by the governor I think it was in December, that allowed for a single DUI to be expunged from your record as long as there was only one. But there's some folks that are looking to reintroduce that legislation. So that's an area where there might be some change as well in the future.
Got it. Before we wrap up one more time, how do folks get in touch with you if they have a question, concern, or maybe want to refer someone to Project Clean Slate?
Yeah. So Reginald, do you mind putting up the last slide with contact information? But it's www.detroitmi.gov/Project Clean Slate. And you can sign up online. Our attorneys will get back to you within 5 days and let you know if you're eligible. Or you can call our number, which is, and I don't know, Reggie, have you been able to pop up that slide? I don't know if I just can't see it. I'm embarrassed that, okay, there it is. 313-237-3024.
All right.
So
we have one more question we want to get in.
Oh, yeah.
Because this is a very important topic. One final question, and then we're going to be wrapping up. So Yelena, do we have what's our question from Zoom?
Okay, so Yolanda asks, can negligent homicide without any DUI be eligible for this program?
No, so any driving convictions that cause injury or bodily harm are not eligible for expungement. But again, I just encourage folks to apply because our attorneys, our attorneys can take a closer look at it, and if there's something I'm missing or don't understand, they're probably the best resource.
Awesome. Ms. Robinson, you have anything else you want to add before we wrap up?
Sure. I just want to say to comment on your work with the marijuana laws. First of all, thank you. I've been following that work because I'm not going to lie, I was a little pissed that I had to go through this process for something that now, is legal, and there's so many people incarcerated for the marijuana piece that it's ridiculous. So I just want to commend you on your work for that. But also just to say that, for folks on the call who are in the community that are in positions of power to really, one of the things I think we also have to change as a community is, this stigma around people applying for jobs with records, right? Because that's like the main thing that I think is also a barrier for people, is how individuals are stigmatized, and because of that, they lack opportunities to better themselves. And so we as a community also have to do a better job of making sure that we're giving people opportunities despite what they may have on their records. And I have to say that I've been blessed in that folks have done that for me. And, even though I had these charges on my record, I was able to do a lot. And so that's my challenge for folks, is to maybe take a closer look at individuals and not just look at what's on their record, right? Because obviously they're applying for jobs and opportunities for a reason, because they are trying to better their circumstances. So again, thank you all for having me here, and thank you, Carrie, for inviting me as well.
All right, that's a mic drop moment right there. So
Yeah.
we're gonna end it right there. Ladies, thank you so much for joining us this morning. And as I always say, you're always welcome to give us updates on anything you have going on moving in the future and want to get out to the community. That means you too, Ms. Robinson. Anytime you want to join us.
Thank you.
All right, y'all take care.
Oh, thank you so much.
All right.
So appreciate it.
Yes, ma'am. Okay, D1, we are now in the lightning round of our D1 monthly meeting. We've got a new segment that we want to call the hot topics. We got a lot of issues that we right now, as we're approaching 11:20, we don't have a time to do a full presentation, but we definitely have the opportunity right now to give you just brief updates on where we stand on these issues. So first, hot topic, Reggie, let's put up adult use marijuana ordinance. We talked about that earlier. Reggie, are you there? Reggie? There you go. All right. So we just, this week, we released on the 19th, certification for adult use marijuana licenses. So this is for the certification for legacy Detroiters. So to be determined or to be certified as a legacy Detroiter, you absolutely receive benefits above and beyond any other applicants. That was January 19th is when we unveiled the new website, which I'm going to give the address to as well. But January 19th is when we began accepting applications for the legacy Detroiter. Now, for those who are seeking licenses for adult use marijuana, you won't be able to do that until April. So between now and then, get your paperwork together, learn all you can, get your information, because it's going to be a very competitive environment as we move forward. But again, the certification for legacy Detroiters have now begun. That's not competitive. So take the time to get your documentation and send the proper documentation that shows that you have lived in the city of Detroit for the certain amount of times as necessary. So now here's the website. You see it on there in that second section there under when will license applications be available? The website, brand new website, just unveiled January 19th is DetroitMeansBusiness.org/homegrown. Again, that's DetroitMeansBusiness.org/homegrown. You have the ordinance on the website. You have the information on the properties that the city of Detroit is selling for a fraction of the market rate, also on that website. Many, many other questions. Also, and then I'll move on to the next segment, you also have information that people have been asking for. How do I know if the location that I'm purchasing is zoned for cannabis use? Well, we have a link on that site where you can type in the information, type in that address, and what will pop up is verification if you are in the clear or if there are any zoning restrictions. So again, the website, DetroitMeansBusiness.org/homegrown. Our next topic, we have the community budget forum. Many residents often ask, what's going on with the budget? How do I participate? Well, City Council is now responding to your concerns. And in District 1, this upcoming Monday, at between 5 and 7, we're going to have the very first community budget priorities virtual forum. If you look at the monitor there, you'll see how you can participate. You can do it via Zoom. You can do it via Facebook. You can also participate by phone as well. And so again, the community budget priorities virtual forum, your chance to let City Council and the administration know what you believe are the priorities, should be the priorities of the city as we move forward in this new fiscal year of 21 and 22. Next topic is, we talked about, I think it's the old Redford Post Office, that's it. We had a bit of an issue regarding the old Redford Post Office located at 22503 Grand River Avenue. For those folks who live in the area, you know that there's been a bit of controversy. Last year, they sent out, actually had a planned on having a meeting with residents to get some input on their plans. Right now, they are planning to move from that particular location. When I had an opportunity to talk to U.S. Postal Service officials, and you remember the kind of madness that we were going through with the the outgoing presidential administration and the post office, things were kind of in a flux. We actually would have had someone from the post office here, but they're in the transitional phase right now with the transition of leadership in the White House. But they did wrap up general feedback from the community via postcard. They asked folks to send in postcards. We haven't gotten yet word on exactly how many of our residents were able to participate and sent in those postcards, but they are looking to make a determination in 3 weeks and evaluate it, and will be presenting us with the information so that we can host a meeting as well as identify what their next moves are going to be. They do plan to make sure that this location on Grand River stays open while they're looking for and identifying a new location. Part of the reason why they indicated a new location was necessary is because it's just too big for the operation that they have going on. And the lease is actually up. So they're going month to month. So they're looking for a location still in 48219. And we're hopeful that we can assist them with finding that location, but just wanted to give folks a bit of information on where that stands as it relates to the what we've heard being a confirmation that the old Redford Post Office at 22503 Grand River Avenue will be moving. But we're going to keep it as best as possible in 48219. And is that our last update we have here? I think that's the last slide that we have. But I also wanted to, oh, that's right, community benefits. Thanks, Reg. Many of you may know that the community benefits ordinance was approved by voters back in 2018. And we had to take some time. There were statutory timelines that we had to wait before we were able to amend the community benefits ordinance. And so we now actually eclipsed that time frame, because it was 1 year. During that time, we have hosted meetings with the community. We've hosted meetings with my colleagues as well. And I say we hosted because it happened in my committee as the chair of planning and economic development. And so we ended up having meetings with the community to get their input on what changes that they would like to see in the community benefits ordinance. We also met with certain other stakeholders as well, members of the development community. We also talked with other interested parties on the changes that would like to be seen. And we did end up having a committee of the whole, I want to say that was 2 weeks ago. Unfortunately, we did not have all of the information that we were seeking, and we are now had to push the new updated community of the whole meeting on the community benefits amendments, community benefits ordinance amendments. We had to move that to a date still to be determined, but we do know that it's going to be 4 months from now, based on us now going head first into the budget process. And we really want to make sure that we focus as much attention on that as we can, especially with all of the financial challenges that the city is going through as a result of COVID. So, keep your ears open, stay tuned. We're going to make sure that the community, that you all know exactly when the next public hearing will take place regarding the community benefits ordinance. And we're going to keep you abreast of that particular issue. Finally, would like to introduce our newest member of our D1 Team Tate family, Ms. Alexis Davis. Now, Alexis joins us. She joined us in November and serves as our policy analyst, in our office. Just to give you a little background, she's demonstrated passion for youth and public service with degrees in psychology and political science, as well as human-centered development and design. Most recently, she held a position as a paralegal at Michigan Community Services, and we're excited to have her on board. So welcome aboard, Ms. Alexis Davis, and you'll definitely be seeing a lot more of her in the months to come. I just want to thank my entire team for your work and dedication during this very challenging time, last year, this year, just for everything that you've done. Reggie, Edwina, Aaron, Lisa, Aisha, Yelena, and now Alexis, I appreciate you all. And I appreciate each one of you who are watching today. Thank you for helping your fellow neighbor during this pandemic that we still remain in. Thank you for being responsible and following guidelines yourself. Thank you for increasing your civic engagement. And thank you for joining us today. Make sure to join us every fourth Saturday of the month at 10 a.m. for our District 1 monthly meeting right here, for the time being, at least virtually, on Facebook and Zoom. And we'll make sure to keep you up to date on all the things that are happening around Detroit and D1, and ensure that you stay connected to those decision makers who have input on the things that happen in your city government. Until next time, be safe, be well, and we'll see you soon. Thanks again for joining us. Have a good day.